Okay. Thank you all so much for dialing in. Those of you who are dialing in, we're going to have folks joining throughout the next few minutes as we dial out and bring people into our Tele-Town hall. We want to thank you for joining tonight's Prince George's County COVID-19 Tele-Town hall, hosted by County Executive Angela Alsop-Brooks, her administration leadership, and partners. My name is David Sloan from the Office of the County Executive, and I have the privilege of facilitating tonight's call. We are thrilled to have you join the County Executive this evening for a comprehensive update on COVID-19, its current impact on our county, and your government's response and management. We have a packed agenda tonight, so we hope you'll stay with us for the entire call, which does include facilitated Q&A with questions that you all have submitted in the number of hundreds over the last couple of days. But you'll hear from the County Executive a few times tonight and Congressman Anthony Brown. You'll hear from our county's Chief Health Officer, Dr. Ernest Carter, our Director of Emergency Management, Ronald Gill, and our county's team of Chief Administrative Officers, the Directors of Strategic Partnerships and Community Relations, whom I'll introduce individually further during this call. We really appreciate you taking the time during this health challenge to connect with your government. The County Executive is always committed to bringing your government to you. And with that, I'd like to introduce our County Executive, Angela Alsop-Brooks.
Thank you so much, David, and good evening, everyone. I want to thank you so much for taking time to join us this evening for our second Tele-Town hall. Tonight, we're providing an update to our community on the government's response to COVID-19 and all of the proactive steps that we are taking to keep you safe during this pandemic. I'd like to say thank you to Dr. Ernest Carter, who's our Chief Health Officer, and I have to tell you that he and the entire team at the Health Department have really put forth heroic efforts to help us navigate through this pandemic and to keep all of our residents safe. I also want to thank Congressman Anthony Brown. He's on the call. You're going to hear from him very shortly. But I can tell you that Congressman Brown has been an amazing partner for us, and he and the entire federal delegation have really done a yeoman's job in terms of working to make sure that our county and its residents receive the relief that we will need during these unprecedented times. Many thanks to our public safety agencies. I've said it once, I'll say it again. We have the most amazing public safety agencies anywhere in the state, whether they wear the Prince George's County Police uniform, fire and EMS uniform, corrections uniform, or the sheriff's uniform. You should know that we are one united public safety team, and during this crisis, they have worked so hard together to make sure that our residents are safe and that they are working collaboratively. I also want to thank all of those on our front lines. We owe them a huge debt of gratitude. The medical staff who are working in our hospitals and in our doctor's offices, those who are at the urgent care facilities and at our FedEx site. They risk their health and safety to care for our families, friends, and neighbors, and we are so grateful to them. We have also come to recognize some additional heroes during this pandemic. Those who are stocking the shelves at our grocery stores, are preparing food at our restaurants for carry out and delivery, and a number of other things that help to keep us fed during this time and safe. And so we want to say thank you to all of them. And I want to say thank you also to our citizens and residents. You've heard me say that Prince George's County is the crown jewel of Maryland, and it is so true. And so I want to thank all of you for heeding the call to stay home, to social distance, and to cover up when you're out and about on essential trips. You've done a beautiful job of really adjusting during these difficult times, and we want to thank you so much for that. Tonight, we're going to discuss the upcoming surge of COVID-19 cases that we expect to occur here in the county. All of our projections tell us that we should be ready for that surge to occur beginning within the next 10 days onward, depending on which model you look at. But the truth is that whether it is 10 days from now, 14 days from now, or 21 days from now, we know that the surge is coming. And while our health is our first priority, and you'll hear a lot about how we're preparing for that, you're going to hear from Dr. Carter and from others on this line. I want you to also know that we are likewise preparing to recover from the economic devastation that we are seeing in our business community, those who are also losing jobs at record numbers, and so our Deputy Chief Administrative Officer for Economic Development, Angie Rogers, is here on the line. She's going to offer new details on the economic relief for small businesses that's available, as well as some relief that's available also for our employees who have lost their jobs. In addition, our Director of Strategic Partnerships, Diana Leon Brown, is on the line. I want to thank her. She will discuss economic relief for our nonprofits who offer really essential services to our residents and citizens. And I also want to say you're going to hear from Congressman Brown regarding the CARES Act that will offer additional assistance through unemployment benefits, substantial grants and loans. But that CARES Act has been critically important, and I want to thank him and thank the federal delegation for the care and diligence that they put forth to make sure that Prince George's County will be able to be reimbursed for many of the expenses that we will incur as a result of COVID-19. And that includes $157 million that we're estimated to receive here to help us to respond to this pandemic. And so although we have had many, many challenges, we thank our congressional partners and others who will help us be there to help us to recover from this. Now, I can tell you, you'll hear more about this, but we are, as of this morning, at 1,464 positive cases of coronavirus and 35 deaths as well. And we continue to pray not only for those who have suffered and been ill from this, but we also offer our very sincere condolences for all who have lost family members and friends to this. And let me just tell you, you hear every day when you turn on the news about the numbers, 1,464. But what I've been saying, and it is so true, is those are not just numbers, they're people. These are our loved ones, our friends, our neighbors, people we care deeply about. And so this pandemic is so personal to all of us. You heard, for example, of Terrence Birch, a counselor and beloved coach from Northwestern High School, who, by the way, is the second school official that we lost from Northwestern High School to COVID. But Mr. Burke was a person who was a mentor, a father, a lifeline to many of our young people. We lost him, and we offer our condolences to his family. We are talking about people like Sean Bowens, who is was a beloved father and husband and pharmacist. He was a person who loved all things Howard University, and he too was lost to this epidemic. We are also talking about people like Leilani Jordan, who was a grocery store worker here in Largo, who, in spite of her own physical challenges, went out to greet people, to help our seniors and others find items that they needed in that store. And she gave her life helping us to COVID-19. And so we're not just talking about numbers. We want it to be so clear that when we talk about the fight that we're in, we're talking about people we love. And of our cases, those range, I've told you that COVID is indiscriminate. The ranges of ages, we have babies who are months old who suffer from this. We have individuals who lost someone who was 90 years old last night. But of our total cases, those between the ages of 50 and 59 years of age lead the county in terms of the number of positive COVID cases, followed by individuals in the age ranges 30 to 39. And then third, we have those between the ages of 40 and 49. And so those are the age ranges where we see the most positive cases in our county. Although, again, I have to tell you, it's a range. Nobody has been immune from it. It's been old. It's been young. We have black, white, Latino. We have rich, poor. It spans all of us. And so far, we know that this has really covered every zip code in our county. And of the more than 1,400 cases that we have, 325 have been hospitalized. And of the hospitalized individuals that we have information about, we know that 78% are black, 9% are Latino, 6% are white, and 7% are listed as other. And again, as I mentioned to you, it goes all ages. We have found that those who are among our most vulnerable have also been affected, including our nursing homes. We have at least 12 of our nursing homes now, at least 14 actually as of tonight, that have positive COVID outbreaks. You're going to hear more about that from Dr. Carter, who will tell you our efforts to collaborate with those facilities to ensure that their residents are safe. We've also been working to make sure that all of our vulnerable populations are covered. You're going to hear from DCAO Mark McGall, who will talk about some of the facilities, such as our correctional facility that's been impacted. But we've been reaching out to all of our vulnerable populations, the seniors, making sure we're feeding our children. We've been talking about how to make sure those in our disabilities communities have also been reached out to. And we've also been, one other thing that I should say to you, and you've been hearing this on the news here and across the nation when we talk about who's been most impacted. You now know that COVID-19 has been particularly harmful to Black and brown people, and to those who are poor and disadvantaged. And I've been often in the last few days, people have been saying, well, what is it that what comment did you have about this? And I can tell you that when we heard weeks ago about some of the aggravating factors, including lung disease and diabetes and kidney disease and heart disease, we were very, very concerned because we knew that we would be hard hit because of the population that we have here, that those chronic medical conditions are ones that we find very often in poor communities and communities that are Black and brown and disadvantaged. And so Prince George's County now leads the state of Maryland in terms of the number of positive cases. And I'll just say very briefly about that health care is so critical to provide it to those who have health care and those who do not. That's the reason that we stood up that site at FedEx Field to make sure that every individual had the opportunity to be screened and tested. We know that for lack of health care, many of our communities have suffered more harshly when these sorts of epidemics occur. We know as well because we lack the food supply that we need, the restaurants that provide healthy food for many of our communities, that we have suffered disproportionately. And so I will say that when coronavirus leaves Prince George's County, it is my great hope that we will never do business the same way that we have done it ever again. Instead, we hope that all of the businesses who we will help to rebuild, and we will help them rebuild, but we hope that as we continue to support them, that they too will support us, and that they will bring to Prince George's County the healthy food options that we need, the grocers that we need here, so that we can continue to keep Prince Georgians healthy, and that we will never again be in a situation where we have the largest number of individuals who suffer from these chronic medical illnesses. Surge plan, and you're going to hear in this call, what are we doing about the pandemic? Well, we have a plan, and we're executing that plan. You're going to hear in this call about hospital readiness, about the additional supplies that we have ordered and those that we've been working with the state to bring here, about frontline support, about standing up various facilities to make sure that we're able to not only bring in additional beds and equipment, but that we have called to the state to ask that we be prioritized for personal protective equipment, ventilators, and other critical supplies that we know will help us not only flatten the curve in Prince George's County, but we believe it will flatten the curve in the state of Maryland as well. So you'll be hearing much more about that from Dr. Carter, also from Mark McGaugh. You should know that we have stood up a quarantine facility to make sure that our first responders, many of whom are on the front lines and are interacting with the public, we have a quarantine facility that is at a hotel. Of course, we are not at liberty to say which hotel and in which location for the confidentiality and safety of those who will be there. But we wanted to make sure that as the exposure occurred, that those individuals didn't have to make the awful choice to go home and expose their family members, and so they are able to stay at that hotel. We've also erected a website to make sure that anyone who wanted to contribute to Prince George's County, because we had a good number of people who reached out who wanted to donate food and paper products and other supplies to us during this time, personal protective equipment, masks, gloves, gowns, sanitizer, can go to mypgc.us /donate COVID-19. So we'll put all of that on our website, but we wanted you to know that we do have a way for you to donate if you are able to. And finally, I should say that this time is a difficult time, that we must continue to care for each other, to ask you to look out for your neighbors, to call and check on those who may not be able to get out and about. And if you are feeling stressed, because this is a very, very stressful time, and we know that many of us will be suffering anxiety and depression, to remember that you can call 211 and dial option 1. And that will take you directly to the Maryland Crisis Hotline. But also just to remember that during this time, as we expect the numbers to increase, that we ask you to continue those practices of social distancing. And let me just say this. This weekend is a holiday weekend. I know that many of you want to gather with your family and friends, and we're asking you just for this year to please continue to social distance, to listen to the medical professionals who are asking us to be careful not to come together in groups until we see this curve flatten. So please continue to do that, and to remember also to continue those sanitary practices and the other things that we're asking you to do. So please go out and get your groceries, but go home. Go out and get exercise with your family members. Walk your dog, and do those things. But please come home afterwards, because it's going to be so important in the coming weeks that we continue to make sure that we're doing the social distancing and that we're staying at home. So I'm going to turn it back over to David at this point. But again, I thank you all for joining the call. We'll answer questions toward the end of it. But I should tell you that it has been a sheer honor to represent you during this time, to tell you that I am not only working for each of you, but you should know that you are in my prayers day and night, you and your families, and we are going to make it through this together. So thank you so much, and I'll hand it back to you, David.
Thank you, ma'am. And I'm going to do a quick re-intro. I'm told that we're at 26,000 folks on the line and climbing. Thank you all for joining the call. That was just County Executive Angela Alsbrooks, who you will hear from again. And I just want to make sure that we are giving you helpful information as we go through this conversation and discussion and report out about COVID-19. Our Prince George's County landing page for the latest county COVID virus information is mypgc.us. You can find videos and links to one-pagers. You can also find the latest updates on government resources and other information. Also, our hotline number is 301-883-6627. Our coronavirus hotline number is 301-883-6627. And also, if you didn't pre-submit a question, that's okay. You can submit a question right now, and we will follow up after the call with everyone who submits a question. The email address is pgctownhalls@co.pg.md.us. I will read it two more times. That's pgctownhalls@co.pg.md.us. Once again, that's pgctownhalls@co.pg.md.us. Also, if you are joining the call now and you want to get the full audio from the county executive's opening remarks, we will be posting the audio from today's town hall on our site, and you'll be able to catch it then. Also, she'll be speaking again before the end of the call. So with that, I'd like to also turn it over to our leading federal partner. That's Congressman Anthony Brown of Maryland's 4th Congressional District, which you know includes Prince George's County. Congressman Brown?
Thank you, David, and thanks for inviting me on the call. I want to start by thanking the county executive, and our county executive, Angela Alsbrooks, is doing just an extraordinary job. If you look across the country, the leadership that we're seeing in those jurisdictions that are managing through this pandemic, it's happening with county executives, mayors, and governors. Angela's got an extraordinary team of professionals, public health professionals, emergency managers. She's involved in working with the school system. So I want to thank you, Ms. Alsbrooks, for your leadership, and thank you for inviting me on this call. Our nation is facing one of the gravest health and economic emergencies in over 100 years. This pandemic has had a deep impact on every aspect of our lives, and Congress understands that bold action is required to address the health emergency, mitigate the economic damage, and provide for a strong recovery. Since the beginning of the epidemic, Congress has focused on ensuring our nation's response puts workers and families first, their health, their wages, and their well-being. We've already passed and signed into law 3 sweeping pieces of legislation, and together these laws dramatically expand critical financial lifelines for families, establish new benefits and protections for workers, create new tools for small businesses to meet payroll and other expenses, provide relief for students in schools. And I think one of the most important things we do is assist state and local government efforts to provide relief, particularly to our most vulnerable populations. And of course, we are supporting our frontline health professionals. Our county executive highlighted some of the activities at the county level, and many of them are supported through federal appropriations or dollars. The Community Development Block Grant Program, First Responders Emergency Management Grant Program, more money for the criminal justice system, housing and the homelessness, a low income home energy assistance program, and a number of other programs supporting SNAP and WIC and supporting meals for our students who are no longer able to get them in school, yet can continue to go to the grab and go site to pick up meals. I just wanted to touch on three provisions in the CARES Act, which we passed about 7 or 10 days ago. And all of these that I'm mentioning are designed to put money into the pockets of families. So let me start with the stimulus check. Most adults will get a one-time $1,200 check. It's my hope we'll go back and do more, but right now $1,200, $2,400 for a married couple. And that's for an adult who makes less than $75,000 a year. Will get the full $1,200, and that phases out so that if you make more than $99,000 a year, you won't receive that check. The checks should be going out next week, direct deposit for those of you who file your income taxes electronically, and the IRS has your bank information. If not, you can go to IRS website and give them your bank information, which I encourage you to do because they'll start sending those out next week. If you are going to receive the cash assistance by check, that's going to take a lot longer, unfortunately. The IRS anticipates sending out 100 million checks. They can only do 5 million checks a week, and that won't begin until the end of April. So as you can see, it'll probably take 20 weeks. They'll start with the lowest income household and work from there. The second provision that I wanted to mention is unemployment insurance benefits. A lot of people on this phone have probably never received unemployment insurance benefits, and while they don't completely replace lost wages, we've done a lot here to try to come close. So in addition to what you'll receive under the state formula for determining unemployment insurance benefits, we are adding $600 a week with the goal of achieving 100% wage replacement for the average worker. Unemployment insurance during this pandemic will apply or be available to full-time, part-time workers, hourly workers, workers who work for in the public sector and the private sector, independent contractors, that's new, self-employed, and sole proprietors. And finally, let me speak to the third provision, again, with an effort to get money into the pockets of families, whether it's that stimulus check or the unemployment insurance benefit, or the third component, which is small businesses. And I think you'll hear more detail about it later in the call. But it's a program where we are providing loans to small businesses with 500 or less employees. It's primarily designed for you to maintain your payroll, but it also can be used for accounts payable and other obligations, rent, and mortgage. Small businesses are eligible, 501c3 nonprofits, self-employed individuals, gig industry workers, sole proprietors, independent contractors. So I recommend that you go to the SBA, Small Business Administration website, if you haven't already, and begin the process to apply for those loans. If 75% of that loan is used for payroll, that portion of your loan will be forgiven. It will be converted to a grant, and there are opportunities for other portions of that loan to be forgiven as well. It's a very popular program, and with that, as well as the unemployment insurance and the stimulus check, there's going to be some delays in getting this out, but patience and a sense of patient urgency is probably what's warranted today. With that, let me turn it back to you, David, and I'll stay on the line for any questions that I may have from the field.
Thank you very much, Congressman Brown. If you're just joining us, welcome to the Prince George's County COVID-19 Tele-Town Hall informational call with County Executive Angela Alsobrooks, her partners and administration leaders. We've heard from the County Executive and Congressman Brown. We'll hear from them again. We're joined right now by over 38,000 of our friends and neighbors in Prince George's County, and the call-ins are climbing. I want to remind you that if you missed the first section, we will be providing the audio for the full call, so don't worry, you'll get that. And also, if you are on the line and you need to call our hotline number is 301-883-6627. That's 301-883-6627. And if at any point in time you want to email a question to us for follow-up after this town hall, you can email us at pgctownhalls@co.pg.nd.us. I want to turn it over quickly to the chair of the Prince George's County Council, Mr. Todd Turner. Please take it, sir.
Thank you very much, David, and thank you, Madam County Executive and Congressman Brown, for your continuing efforts on behalf of the residents of Prince George's County. I just want to say on behalf of my council colleagues and we all share the deep concern about, obviously, the catastrophic impact of the coronavirus pandemic on the health and safety of all Prince Georgians. Obviously, COVID-19 has changed the way we live, the way we work, and how we work together, even as we try to move the county forward. So over this period of time, we've been working very closely with County Executive Angela Alsobrooks, her executive team, the county's Department of Health, Office of Emergency Management, as well as all of our state, federal, private, and not-for-profit partners to address services, information, and any necessary resources to the county in response to this health emergency since County Executive Alsobrooks declared the state of emergency on March 16th. So I just wanted to briefly say that in addition to the things that you will hear this evening and the resources that are available to you, members of the County Council are also available to you, even though we are working remotely, as most of the county government is. So I encourage you to still reach out to us either by phone, email, or social media if you need any assistance during the course of our dealing with this pandemic. And in conclusion, I will simply say, as the county executive said, we're extremely proud of how Prince Georgians are coming together to address this health emergency. Obviously, we ask for your continued prayers for those directly impacted by the crisis and for, obviously, our county, in addition, our state, our country, and this world as we address this issue. So thank you for joining this call this evening. And once again, we are partners with the county executive and our other partners working on your behalf. Thank you very much. Thank you, David.
Thank you, Chair Turner. At this point, we're going to move to the county-based section of updates. We're going to start with a very important set of updates from our health department with Dr. Ernest Carter, our Chief Health Officer, and the Director of our Emergency Management Agency, Director Ronald Gill. Dr. Carter, we'll start with you.
Thank you, David. Thank you, Madam County Exec and Congressman Brown and Chairman Turner. And good evening. Right now, the number of positive cases that we have in Prince George's County is over 1,600. We've got an additional 200 today. Most of these increases in labs have come in are the result of the commercial labs getting caught up on their backlog. So we're not overly concerned about it. We understand that we're having these increases. The other thing I wanted to update you about is our FedEx field efforts are going very well in terms of screening and testing. The way to get an appointment there is to call our number is 301-883-6627, where we will actually do a telehealth assessment and then give you an appointment. The third thing I would like to update you about is what's going on with our nursing homes. Our county executive has updated you about the numbers of nursing homes that are currently involved. The state has reached out and has formed these strike teams that help us to make better assessments and do better investigations, and also come with medical health and testing, which is greatly needed. So if you see a person in a National Guard uniform, they are a part of that team. They help with the assessment, and it's really a good thing. The fourth thing I'd like to just give you a little bit of information about is our current way we're going to enforce social distancing. The governor has empowered the health departments to work with our counties to make sure that our businesses are doing the social distancing, and we're going to enact that next week once the state gives us more direction on it. Lastly, we're really working very hard in this moment to make sure that we're ready for when the hospital gets to capacity so that we can surge up the capacity so that we can make sure that all of our Prince Georgians have a bed when they need a bed, a critical bed when they need a bed, and a ventilator when they need a ventilator. So having said that, I will end my report and pass it on to Ronnie Gill.
Thank you, Doctor, and thank you, David, County Executive, also Brooks, Congressman Brown, and Council Chair Turner. From the emergency operations standpoint, we continue to focus on the strategic direction and operational decision-making, and right now that focus is on hospital surge. We continue the coordination between our municipal, local, state, and regional partners to address resource management, COVID-19 planning, and informational gathering and dissemination. So we're putting out one message to the community. Two operational areas that are underway in coordination with the health officer and the health department are, and as stated by the county exec, the operational management of our quarantine site. As stated, we have set up a quarantine site for our first responders, healthcare professionals, and other county employees or county employees who have COVID-19 or those suspected of having COVID-19. The site opened last week and is currently occupied. The site allows for our employees to stay quarantined around family and friends safely without the risk of spreading it to others within the home. At this time, our biggest focus is on surge. Our efforts towards preparing for the number of surge cases we anticipate. This surge will put a lot of strain and stress on our hospitals and the healthcare system. Both the Office of Emergency Management and the Health Department are working closely with our hospital systems to understand and analyze their needs regarding staffing, supplies, and equipment. We're also working with the hospitals to determine the best locations where we can work with them to set up alternate care sites, convalescent sites, and advanced medical tents. These sites are being set up prior to the surge and are underway as we speak. This is an effort to alleviate some of the pressures that we know will come to the hospitals during that peak. Lastly, we continue to work with the state and our private partners with helping the healthcare systems in acquiring needed resources such as the personal protective equipment and ventilators as we prepare for the surge. Thank you, and I'll pass it back to you, David.
Thank you, Director Gill and Director Carter. If you're just joining us, thank you for calling in to the Prince George's County Tele-Town Hall for comprehensive COVID-19 updates with County Executive Angela Alsobrooks, her administration leadership and partners. We've heard from the County Executive and Congressman Brown. We've also heard from Dr. Ernest Carter, our Chief Health Officer, and Director Ronald Gill of our Emergency Management Services. We have full audio of this call that you will receive that will be available to you on our website. So if you've just joined us, you will be able to hear the call in its entirety. We appreciate the approaching 50,000 Prince Georgians who are on this line. Now we're going to hear from the county's roster of Deputy Chief Administrative Officers, or DCAOs, that's Deputy Chief Administrative Officers. Now you may be asking yourself, what is the role of a DCAO? These individuals have the collective responsibility of working to provide oversight for the over 40 agencies throughout our government. They work in concert with individual agency directors to ensure that our government is performing at as high a level as possible. And they work well together as a unit for the Alsobrooks administration. I'd like to introduce our first Deputy Chief Administrative Officer for Health and Human Services and Education, Dr. George Ashew.
Thank you, David, and good evening, Prince George's, my Prince George's County family. And I really mean that when I say we are a family. We are a family of 1 million. And the most important thing I think I can say to you tonight, and it's echoing the words of the county executive, and that is to continue to practice social distancing, to do the things that we can to protect not only ourselves, but those that we love, those around us. And I love this community. I love Prince George's County, and I want us all to be safe. So stay at home unless you absolutely have to go out, unless it's an essential task of, buying food, getting medications. It's certainly okay to go out, to take a walk, to exercise. We actually want you to do that, but we want you to go out and wear a mask, gloves if you have them, and when you come home, wash your hands clean, and wipe down all the surfaces that you may have touched before you had a chance to wash your hands. Again, when you're just because you're wearing a mask doesn't mean that you should stop your social distancing. Wearing a mask is another layer upon that. So I know this is not easy. This will not last forever. If we continue to do these things, we are going to emerge as stronger individuals. We're going to emerge as stronger families. We're going to emerge as a stronger Prince George's County family. So with that said, I'll give you some updates on part of the portfolio that my Health, Human Services, and Education team covers. From our schools, we know that starting last Monday, the county public school students can now pick up a week's worth of grab-and-go meals and fewer visits. The meal pickup now occurs twice a week going forward, and students can get meals for 2 days on Mondays and 3 days on Wednesdays. Just a note to folks, there will be no meal service on Monday the 13th of April due to spring break, and service is going to resume on the 14th with 1 meal, and then 3 meals again available on Wednesday the 15th. Breakfast, lunch, and a snack are available at 43 sites. 43 sites. Parents may now pick up the meals for students who are unable to come to the site by showing a student ID or report card. Those meals are available from 10 a.m. to 1 p.m., and parents and guardians are not required to accompany students, nor are students required to show ID. Further information can be found at www.pgcps.org/coronavirus, coronavirus/meal-site, MEAL-SITES. And David, I hope we'll have an opportunity to repeat that later for folks who may not have gotten it. Our Department of Family Services has been providing nutritional food delivery services for seniors. The total number of seniors served to date is over 800, nearly 900. The total number of meals provided has been close to 20,000 meals provided in the county. So we are following and taking care of our seniors. And again, as a family, we're going to get through this. The total number of emergency meal kits provided have been almost 250, and we've also served a great many of subsidized apartment buildings with seniors in them. And I think at this point we've served 10 of those apartment facilities. Our Department of Social Services continues to accept applications for benefits. Although our buildings are closed to the public, residents are encouraged to apply for benefits using mydhrbenefits.dhr.state.md.us. That's mydhrbenefits.dhr.state.md.us, or by phone by calling MD Hunger Solutions at 1-866-821-5552. That's 1-866-821-5552. The department has mission-critical staff processing applications every day, hundreds of applications. So we're on it for you, our Prince George's family. Our Prince George's Memorial Library has offered dozens of virtual programs in the last week, including live virtual read-alouds, a Census Day Town Hall, community conversation with the CEO, Roberta Phillips, and programs from third-party organizations like the Kennedy Center. They have also seen a tremendous use of the online library, which has increased dramatically during the library's closure. So So we encourage you to continue to use the online library, and really proud that you're looking at ways to sort of entertain yourself doing, again, what we know is a stressful time for you with quarantine and isolation. And finally, I'll mention our Prince George's Community College. Very proud of our community college. They distributed over 400 laptops to faculty and staff to make sure that they could continue providing access to the college's essential systems while working at home. And in fact, over 98% of their employees are currently doing all their work at home. And again, this is important. This is your county leadership demonstrating an example of what it means to social distance. Even though it's tough for us, it's tough for the students, we know it's important, and we hope you'll follow our lead in social distancing. That's it for my report for now, David.
Thank you, sir. And we will make sure that all of the phone numbers and email or web addresses are made available on our website as we publish the notes from today's call. Now we'll hear from the Deputy Chief Administrative Officer for Government Operations, Ms. Tara Jackson.
Thank you, David. Let me start by saying that this government's goal is to achieve maximum efficiency and to continue to provide needed services during this pandemic. I am pleased to report that your government is resilient, and we are doing well in that we are able to provide most of our government services even in light of the crisis. We are currently preparing ourselves inside the government for the impact of a surge on our operations. We again want to make sure that even throughout a surge, we're able to provide as many services as we can to this community. As you would expect, our employees are not immune to exposure, so we have had employees exposed and we have had employees test positive. But in that regard, we remain vigilant in our effort to prevent the spread to other members of our community and other employees. So I will say that there are some services that have been limited in order that we can ensure that folks remain safe at least to the best of our ability. I oversee the Department of Permitting, Inspection, and Enforcement, DPI. Although DPI is maintaining most of its normal functions to include inspections, permitting, and plan review, and I'll say that those are happening primarily electronically, although there is a drop box that citizens can use at the DPI offices. We have limited the essential functions or the functions of our enforcement division. And so property standards inspections have been limited, again, to make sure that our community members and our employees are protected. If there are property standards issues that you have and that you want to report, we are certainly taking the information. We are doing our best to contact complainants, and then we will automatically reinspect those properties within 30 days, or if the emergency has not ended within 30 days, within 60. And we're doing our best to advise complainants as to actions that can be taken in lieu of an on-site inspection by a DPI inspector. Just briefly, permit applications, licenses, we don't want anything to expire during the period of this emergency, so all licenses and applications will be extended for 30 days after the emergency ends. Again, if we can help it, there should be no expirations as it relates to permit applications and licenses. Lastly, with regard to our Office of Human Resource Management, we are doing our very best to address the need of our over 6,000 employees. And then with our Office of Central Services, we continue to procure necessary goods and services for this government. As you might imagine, it is quite a task during this crisis, but we are hard at work. And we are also maintaining our buildings, grounds, and fleet. That's all I have, David. Thank you so much.
Thank you, DCAO Jackson. We'll now hear from the Deputy Chief Administrative Officer for Government Infrastructure, Environmental Services, and Technology, Mr. Floyd Hope.
Good evening, Madam County Executive Officer Brooks, Congressman Brown, Council Chair Turner, and members of the Prince George's County community. I just want to enforce that we continue to provide crucial transportation services. We're delivering meals to the seniors. We're delivering all seniors for their medical appointments and dialysis treatments. We're transporting them to grocery shopping. And on average, we're delivering and transporting about 160 seniors per day. Our Department of Public Works and Transportation continues to run the bus service on a limited schedule to assist residents who need to get to work for essential work services. And our Department of the Environment continues to pick up trash, garbage, and recycling 5 days a week. We're continuing to maintain our roadways, our traffic lights, and traffic signals. And we're available for on-call services for any seniors who need to be picked up. I'll yield back, David.
Thank you, sir. Now we'll hear from the Deputy Chief Administrative Officer for Public Safety and Homeland Security, Mr. Mark McGaugh.
Good evening, everyone. And I'll try to be brief also. Just a couple things I wanted to mention. The governor's executive order is important, and I need you to take it to heart. But I also need you to understand that the social distancing saves lives, and that's our whole focus with this declaration. It is not martial law. So if you need to go to the store, the grocery store, you have to get a prescription, you have to check on family. We want you to exercise all of those things. I just don't want you to worry about that. I just want you to really keep it in the back of your mind and why it's important. And it's important because of social distancing. And the more that we can do that, the more that we can drop this curve of this virus. So it's important. Police are not the last resort for police or to arrest anybody. We're not trying to do that, and we won't do it. The first protocol for the police under this declaration is to engage folks and to encourage them to, finish your essential duties that you need to take care of and then go home. Because the social distancing and being at home, you're safe and the rest of the community is safe. So, and I appreciate everything that our community has done over the 2 weeks that this has been in place. You've really listened, and that's important. Just quickly, some of the things that we've done in public safety, and we've been working on this contingency plan for months, hand in hand with the health department. Each agency has reviewed the shift plans and its staffing models and response protocols. We've tried very hard to educate our community or our workforce to make sure that they understand the risk, but also how to be effective in this environment. They're there to support you and to take care of you, and they can't do that if they're sick themselves. So we've really made a strong push to make sure they understand this virus as much as we can. Some of the things that have happened, 911, if you call 911, you're probably going to get some extra questions because 911 started actually 2 months ago, screening calls to see if there's any relationship to a call and this potential virus. And if there is, the fire department's going to show up. We are always going to show up. Let me tell you that. We're always going to show up. But they may be in surgical gowns. They may have masks on. Probably they will have masks on and gloves. And they very well may put a mask on you immediately as they assess what's going on. That's for your protection and for theirs. The fire department has done a tremendous job. They've moved all their admin staff that are sworn into operational positions. The police department has enhanced their telephone reporting unit. So if there's a crime that occurs, a theft, and there's no suspect on the scene, they will prompt you to make a phone call, or they'll call you back to take the report so that we can get that on record and investigate it properly. But that leaves officers in patrol for violent crimes and crimes that are in progress. We're also moving very aggressively towards surge planning, and we're prepared to change our shift plans and staffing postures as things develop to always increase the patrol force and also enhance the fire department's EMS capabilities. I recently, last week actually, I spoke to all the chiefs and directors, and I kind of pushed them to expand their planning process. And really what we need to do and what we're doing right now today is looking at where we can cross disciplines. Now, that's not natural in public safety, but it's something that we think we need to do and be prepared to do. I'll just tell you about communications. Communications is doing fine, but it's the core of what we do. Everything begins and ends with communications. What I asked the director of communications to do is identify dispatchers that have left communications and gone either the fire department or anywhere else in the county government. There are 38 that have been dispatchers and have left and gone to other jobs within the county government. That whole group is going to be retrained or refresh training this week, next week now, so that if we have an issue with communications, we can backfill with those folks. And I've talked to the fire chief about, my thing is, if we have a medic and an ambulance and we have nobody to drive it, I'll find you somebody to drive it. It may be a sheriff, it may be a police officer, I don't care. But they're coming, and we will always be coming. So I've stretched them, to be honest with you, beyond, what we've seen in the past, but you have a great public safety group. You have great people that are willing to step up every day, and I expect them to step up in this case, and I know they will. So you have a lot to be proud of. What I told them at the end of the conference call last week was, look, we may all wear different patches on our arms. You may have a sheriff's patch or a police department patch, or a fire department patch. But every one of those patches, even though they're different, every one says Prince George's County on it. Every one. Everyone in public safety took an oath to protect our community, and that's what we're going to do, and that's my commitment to you. David?
Thank you, sir. And our final TCAO, Deputy Chief Administrative Officer for Economic Development, Ms. Angie Rogers.
Good evening, and thank you, David. I'm going to focus my remarks on relief and resources for individuals, including those who are unemployed and for businesses. So first, for the resources that we have available for individuals, on Monday of this week, Employ Prince George's, which is the county's workforce development agency, launched the Hourly Wage Employee Relief Fund. That fund is going to provide $200 cash gift cards to people who've lost their jobs due to COVID-19. There's a website where folks can go to apply. It is Employ PG Edge. That's EDGE, employpgedge.com to apply. If they're having issues, there's a phone number that they can call, which is 301-618-8445. One of the things that we want to make sure that folks know is that if you don't have a Social Security number, this question has come up a lot, please apply for the cash card anyway if you need it. We mostly source the funds for this employee relief fund from private sources, so we're able to do that. And so if folks feel like they might not have the proper identification, please call that number anyway, and let Employ Prince George's help you. Those cash cards, we really hope will help to bridge the gap for people who are waiting for their unemployment insurance to be processed. We know and we've heard that there have been a number of problems with the state unemployment application system. It is due to the sheer number of folks who have been trying to access that system over the past month. It's been an overwhelming number, but we are encouraging people to keep trying, and they can try to access particularly the online application in off hours, so that's in the evening or before 7 in the morning, when there's not so much traffic on the site or on the phone line. They are now contact days assigned by last name, and we encourage people to follow those guidelines to access the line. So if your last name begins with the letters A through F, your day would be Monday. G through N, your day would be Tuesday. O through Z, your name would be Wednesday. Thursday and Friday are the open days. The number for that state unemployment system is 410-949-0022. You can also reach them by email. The email address is ui.inquiry, that's INQUIRY, at maryland.gov. So ui.inquiry@maryland.gov. As the Congressman mentioned previously, the Federal CARES Act also added a number of financial benefits and other protections for workers. So for those who are getting unemployment benefits, the CARES Act added an additional $600 a week for up to 4 months if you're getting unemployment benefits. And another huge thing is that the CARES Act has made it so that 1099 and gig workers can now also apply for unemployment benefits. So that's a huge and important expansion. There are also protections in there related to, for folks who are still working, but need sick leave or need leave to stay at home because of school closures. There are protections in the Federal CARES Act to make sure that people can take that leave. There are also a number of things that we've propped up for the businesses in our county. So the website for our Economic Development Corporation, which is pgcedc.com, is the clearinghouse. We've really been using it as a clearinghouse for all kinds of information related to economic development, impact, and relief during this time. Last week, County Executive Angela Alsobrooks announced the Small Business Relief Fund, and that's going to allow businesses to apply for loans up to $100,000 and grants up to $10,000. A very special thank you to Chairman Turner and the rest of the council for their leadership in making this fund available. Applications are going to open for that fund this coming Monday, April 13th, and businesses should go to pgcedc.com in order to apply. If they want to stop by there already to get information, you can also do that. We did a webinar last week covering those local funds that we have available in addition to the federal and state funds. And that webinar is up on the pgcedc.com website. So if you are planning to access some of these resources or looking to get more information, you might want to tune into that webinar. Businesses who are applying for the county relief funds will need to demonstrate that they've also applied for the federal Small Business Administration funds as well. They don't need to have a completed or approved, or they don't need to have an approved application, but they do need to demonstrate to us that they've applied. Our county funds are meant to pair with those state and our federal funds. There were state disaster relief funds available as well. The application window for the state funds has closed, but the window for the Federal Small Business Administration funds is still open. So through the Small Business Administration, businesses and nonprofits can get loans through the Paycheck Protection Program up to $10 million, loans from the Disaster Economic Injury Disaster Relief Fund up to $2 million, and grants up to $10,000. So there's a number of resources available, and folks businesses should definitely feel free to reach out to us if they are looking for what's out there to support them during this time. Thank you, David.
Thank you, DCAO Rogers. So thank you all for joining us tonight. We're going to move into our question and answer. If you've just joined us, this is the Prince George's County Tele-Town Hall informational call with County Executive Angela Alsop-Brooks, administration leaders and partners. My name is David Sloan from the Office of the County Executive. I'm facilitating tonight's call. It is an honor. We're going to go to our Q&A right now. I want to just mention that if you still have questions that have not been answered, that you remember this email address, which you can email at any time, and our Q&A team will follow up with an answer. It's pgctownhalls@co.pg.md.us. That's pgctownhalls@co.pg.md.us. You've heard from a lot of folks tonight in leadership, and we will be making sure that the audio of this call is made available. And we want to point you to our coronavirus informational page, which is mypdc.us, mypdc.us. We want to thank the hundreds of people who submitted questions before tonight, and I'm going to go through several questions that represent kind of the buckets of thematically of what people all are asking. And I'll start and point this first question towards County Executive Alsop-Brooks from Angela Sloan Goings from Riverdale, Maryland. County Executive, can you speak to the current collaboration with the state and our neighbors, and how do you feel it's going? Thank you very much.
Okay, thank you so much, David, and thank you everyone for joining the call tonight. Our collaboration with our neighbors has really been exceptional. I hope that you have witnessed really Maryland coming together. I can tell you, for example, that I have had a phone call every day with the top 7 county executives in the state. We've also been in collaborative conversation with the district and our regional neighbors as we talk through ways that we can better serve you. So the collaboration has been excellent as we talk about ways that we, for example, can get more of those personal protective equipment and supplies in. We've talked about everything from unemployment to how we can, for example, provide information. The big issue lately has been about providing demographic information that people wanted regarding the numbers for COVID-19. But any range of issues, we've really come together to help and assist each other, and I think it's been a really positive effort. And you know what? It is our great hope that going forward, and I said it and we'll repeat it, that we hope that after COVID-19 leaves, and it will leave, that we will never do business as usual again. I think we've come up with so many terrific ways that we can work together. Angie Rogers didn't have an opportunity to speak to the fact, for example, that that many of us signed onto an agreement, including some of our neighboring counties, to pursue economic opportunities together. This is unusual. This is something we've never done before, but there was a regional agreement that we would pursue economic opportunities together as a region to bring some of those jobs and businesses to this area. So that's the kind of collaboration that we've seen come out of the distress that we're in, and I think that because of it, we're really going to emerge stronger than ever.
Thank you, ma'am. Our second question comes from Rita from Hyattsville for Congressman Brown. I'm laid off because of this crisis. Do I wait to apply for unemployment insurance? Who's included now that Congress has expanded eligibility? How much can I get?
No, thank you, Rita, for the question. You certainly don't want to wait to apply for unemployment insurance benefits. Keep in mind that when you do, and you can do it over the phone or you can do it on their web portal, there is a considerable delay in processing those applications. And think of it this way, Maryland and the country is experiencing historic rates of first-time unemployment insurance claims. It's a system that was designed like a funnel, if you will, that could take 1 gallon of water a minute, and we're now trying to put about 15 gallons a minute through that same funnel. So I do, and I said it at the close of my remarks, be patient. So whether you're a part-time or a full-time worker, whether you work in the private sector or the public sector, whether you are an independent contractor, self-employed, or sole proprietor, you can now apply for unemployment insurance benefits. We've extended, through the support of the federal government, the time period in which those benefits will last, and we've added an additional $600 per week to whatever you would otherwise get under the state formula. And our goal was to do a 100% wage replacement for the average worker for the next 4 months. So the short answer to your question is apply immediately and just be persistent. There is a delay. However, what you eventually receive in unemployment insurance benefits will go retroactive to the first day that you were either furloughed or laid off. Back to you, Dave.
Thank you, Congressman Brown. This next question is for DCAO Askew and Dr. Carter from Winifred Swinson. What is the process for getting tested? How many testing sites are currently online?
Well, the process for getting tested at the FedEx field site is to call 301-883-6627. That'll get you to one of our physicians, a nurse practitioners, who will make an assessment. And if you are able to show, if you're showing symptoms and signs, they will make an assessment, and then they will refer you to the FedEx field if you meet the criteria. The other places you can go to get tested they have MDA sites in Waldorf and Glen Burnie and Bel Air, but also your physician, the urgent care hospitals. Those are the places that do the testing in our county and in our surroundings.
Thank you, sir. This next question is directed at DCAO McGaw, and forgive me, it's from Yvette Thomas, and her question is, will any additional resources, PPE, be given to the municipality's essential personnel, police, and public works to better assist residents? Also from Darlene Smith.
Okay. The short answer is yes. The municipalities, and my background, as you know, is with the police department. I mean, the municipalities are important partners, and we work hand in hand every day. I mean, literally every day, every hour of every day, protecting the community. So when we got the first allotment of personal protection equipment last week or the week before, that was a major priority, to make sure the municipalities had what they needed. We don't have enough. I mean, we have adequate supplies right now, and my understanding is the municipalities also have an adequate supply. But as those supplies come in, I guarantee you that we're going to share those resources with you, because we're all in this together, and you have great police departments at the municipal level, and we depend on them every day. I guarantee you we're going to continue to supply as much as we can to the municipalities.
Thank you, DCAO McGaw. So I have two questions generally for our Office of Community Relations. I know we have our Director, Anisha Davis, on the line, so I'm going to give you both these questions, ma'am. The first is, how can local civic associations and community groups help our county government and our communities? And also, a general question is, what's going on with the census? So I'll let you take those both.
Thanks, David, and good evening, everyone. The Office of Community Relations continues to keep residents up to date through our weekly What's the 311 conference calls. The calls are held each Thursday, 10 a.m. and 6 p.m., and we encourage you to tune in as you will receive information pertaining to non-emergency government services and information that will be able to connect you quickly to available resources that you need during this time. Our Common Ownership Communities Division held a virtual meeting on yesterday with Delegate Nicole Williams to provide useful information regarding HOA enforcement regulations, operating regulations. Many residents are asking how can you assist or how can they assist. So we are taking donations to support those in need during this time. We are collecting toilet tissue, paper towels, basic need items for young mothers and seniors. And if you are in a position to give, please go to the Prince George's County Government website and click the Donations for COVID-19 button. Someone from the OCR office will get back to you once the form has been received. And David, the second question was pertaining to the census. And yes, we are actively working on the census and to get our completion rate up. We want to say thank you to the 47.2 households who have completed their census. In 2 weeks, a week and a half, we will have a census midday meetup hosted by Joe Claire on April 18th from 2 p.m. to 4 p.m. where you'll have a chance to listen to music and relax with the family and complete your census. It really just takes 10 minutes. For every person that is not counted, we lose $18,250 in federal funding. 10 years ago, we lost $363 million. This funding is used to help fund schools, roads, hospitals, Medicare, and so many other programs. So we are counting on you to complete your census. And by completing your census, you're showing that your Prince George is proud and proud to be counted. Over the next 2 weeks, you will hear from the Office of Community Relations. We will be calling just to remind you to complete your census and share the message with your family and friends to complete the census. Again, it takes 10 minutes or less for you to complete your census. And it's proven that during this time, this is why we need you. We need your support to complete your census, because it's now that we get the proper resources we need, but we only will get that if we have a true count of everyone that's in the county. I hope I answered your questions, David, and thank you for allowing me to have a chance to respond.
Thank you, Director Davis. And we're coming up quickly on 9 o'clock, which is the end of our call. We have a few more questions left, and we'll get those in. This next question represents a lot of questions that have come in about nonprofits and our partnerships with them. I know that our Director of Strategic Operations is on the line, Diana Leon Brown. So the general question is, where do nonprofits go for information and support? What's the nature of our relationship with nonprofits at this time?
Thank you, David. Hello, everyone. I hope everyone is safe and well. We are providing 2 infographics that will be available on our website after this call. The first one is what our nonprofits need to know, and it has information about the status of the community partnership grants and the links that you can go to get information. We've been getting a lot of phone calls about where there are additional grants in addition to the CARES Act. We've been working diligently with the Community Foundation and our regional philanthropy partners. The Community Foundation has started a COVID-19 fund. The link is on this graphic, and the money raised from that fund, 20% should come to Prince George's County because it is a regional fund. So we've been very active and present and working with our philanthropic partners, United Way, Community Foundation, RAG, National Council of Nonprofits, to ensure that we are there and participating and that they know our needs. So we are encouraging our nonprofits to contact them and get information about how to apply for those funds. We also have been working very closely with the Maryland nonprofits. Their website and link is also on this infographic. I strongly encourage our nonprofits to go there. They've been working very closely with us on providing webinars and training and information on the COVID-19 response, and it's available to all of our nonprofits in Prince George's county, whether you are a member of Maryland nonprofits or not. And then lastly, the other graphic that we have is actually a graphic that we have borrowed from the National Council of Nonprofits. And it really breaks down the loans available for nonprofits in the CARE Act and what the description of the nonprofit should be, the size, eligibility, the dollar amount, where to go to process the loan, et cetera. And it's a really useful chart without having to read all the details. It just kind of lays it out very nice and clearly. And then lastly, I send out emails 2 or 3 times a week to our strategic partners. And if you are not on that mailing list, please email me directly at dlbrown. Make sure the L is in there because it goes to somebody else if the L's not there. So it's dlbrown@co.pg.md.us. And then lastly, we also have a nonprofit email, pgcnonprofits@co.pg.md.us, which is also on the link for information about the community partnership grant. So I hope that answers the question. And please sign up for our email list because we try to provide information as it becomes available and other opportunities that may be outside of the county, but perhaps in the region that our nonprofits are eligible for. Thank you, David.
Thank you, Diana.
David,
and again, we are going to make sure that we publish all of the information online. Sorry, who wants to get in there?
David, sorry, this is County Councilman Turner again. I just want to remind folks who are not-for-profit communities that there are still grants available through the County Council in addition to the community partnership grants, which are the grants through the County Executive's Office. So I would encourage everybody to go to the Prince George's County Council's website. We are about to announce a grant program for those groups that are already received grants from the County Council through the special appropriation grants, but are specific to whether you're doing response to COVID. So to the extent that council members still have funds available through the special appropriations grants, there's a shorter application as part of that. So we'll be reaching out to those organizations that have received funding in the past if they're providing COVID-19 response to allow them to apply for funds that are still available. Thank you.
Thank you, Chair Turner. So I'm going to try and get 2 quick questions in here, and then we'll close out our call. I'm going to go back to the Department of Health for Dr. Carter and Dr. Askew. But I also want to, before I do that, Dr. Carter mentioned the call-in number for FedEx Field for testing. I want to just restate that. I know it's an important number for folks. That was 301-883-6627, 301-883-6627. That's for testing at FedEx Field. This is another question that everyone's asking. This is particularly from Erica Williams. Does the county recommend everyone wear a mask? What else should residents do to mitigate their risk?
Thank you, David. That's a very good question. The answer to it is yes. We recommend that everybody wear a mask. Wearing a mask is like covering your mouth continuously. And for people who are walking around asymptomatic but carrying COVID, that mask actually helps not spread the COVID. It doesn't protect you from getting it, but it definitely helps people from spreading it. So if we love each other, then we would put on a mask when we're out and about. When you're at home, you don't have to wear a mask because you've been in the family and everybody's asymptomatic and you can be okay. But when you're going out and about, you should definitely wear a mask. I think if you wear a mask and then if you make sure you're doing all of the other things, like when you're coughing, you cover your mouth. If you have a mask on, that'll help. If you're making sure you're washing your hands. Washing your hands is one of the most important things you can actually do. Because it keeps, if your hands are clean and you're not putting them in your face and taking them from surface to your face, or you're protecting yourself. So make sure you're washing your hands. And if you can wear gloves when you're doing a function outside, like if somebody delivers food to your doorstep, if you have gloves on, that's really good. And make sure you take the packaging off of that food, because you don't want to touch things that other people are touching right now. You don't know if they actually put droplets on it. Now it's okay to go out to a rest to get carry out food. If you go out and get some food carry out, that's great, but throw the wrapper away. Don't touch. Try not to touch things and then touch yourself or put it on your car and put it in your face. But those are the things. If you keep your social distancing, you protect yourself and protect your others, and keep those type of things in mind, we will overcome this disease. We will overcome this. We will flatten our curve. We will get past this. So that's what I really am happy you asked that question, because that is, wearing the mask is an important thing to do. It doesn't have to be a N95 or N99. It can be just a covering that will help those droplets from getting out. So thanks for that question.
Thank you, sir. And the final comment on questions that I'll make before turning it over to Congressman Brown and the county executive to close us out is we got a question from Addie, which is about food access and basically where can people go for assistance during this time. And so I have a response here, which is the COVID-19 pandemic has continued to impact normal pantry operations. We all know that. And so residents may be experiencing some blockage in availability that we haven't seen in the past. But our Office of Community Relations and the Department of Social Services conduct weekly scans so that we remain aware of active resources that we can direct residents to accordingly. We publish our list of food resource options each week on the county website on our COVID-19 page, which is mypgc.us. We also push that information out through our social media pages at CEX, also Brooks on Facebook and Twitter. And we're also working with the Prince George's County Food Equity Council to help distribute the information they have about available food resources. And finally, in addition, the Capital Area Food Bank has a website for COVID-19 updates. That's www.capitalareafoodbank.org/COVID-19 response. That's capitalareafoodbank.org/COVID-19 response. So we hope that the questions that we were able to actually lift for today from the hundreds of submissions represented thematically what a lot of people are asking. If you didn't hear throughout the course of the presentation and the conversation the answer to your question, please email us at pgctownhalls@co.pg.md.us. That's pgctownhalls@co.pg.md.us. And please use our hotline, our coronavirus hotline if you need it. It's 301-883-6627. That's 301-883-6627. And so now we will close out our call, hearing from Congressman Anthony Brown and our County Executive, Angela Alsop-Brooks.
Thanks, David. Congressman Brown here. Again, I want to thank our County Executive, Angela Alsop-Brooks, very much leaning into managing us through and leading us through this pandemic. She's put together a team, as you've heard tonight. They're knowledgeable, they're experienced, and they're committed. So I want to thank you. Look, over the course of the next few weeks, Congress will be continue to do the work that we need to do. We're going to be focusing on more resources to small businesses to keep people on payroll. We're going to be focusing on more money to hospitals, community health centers, and systems to make sure that they have the resources, particularly for personal protective equipment, the other medical devices they need to deliver the services. We're going to be focusing on more money to state and local governments to manage the crisis and mitigate the lost revenues that we are experiencing in local governments. And we're also going to be focusing on that issue that was raised by the county executive in her opening remarks, and that is addressing the health disparities that exist. Yes, it's in the short term. We're seeing a disproportionate impact on the African American community, but it's also a long-term problem, a persistent problem of health disparities between black and white, rural and urban. So we'll be addressing that as well. Look forward to working with our county executive. I say to everyone on the call, stay safe.
And I just want to jump in and say thank you so much, first of all, to David for facilitating the call tonight. I also want to say thank you to Congressman Brown for his leadership and for his collaboration and work with us. I want to thank Chair Turner and the County Council also for their leadership and for the amazing job they have done. And to our executive leadership team and all of our employees in Prince George's County government, I just could not thank you enough for the amazing job that you all have done. To the 61,000 people who called in tonight, we've had 61,000 people on this call. This, as always, I think really does embody the spirit of Prince George's County, how resilient we are, how loving and how diligent and earnest this community is. It is so inspiring, and it is an honor to work on your behalf. And so I say to all of you to please continue to listen to the healthcare professionals who advise us to social distance, to cover up when you go out for essential items and things, to stay home as much as possible, and just to work with us as we ride this out. COVID-19 will not last forever. My grandmother used to say that tough times don't last always, and this is so true, and this is true during these times as well. And so we will continue to hunker down. I assure you that this government is hardworking. It is nimble. We will not rest until we restore everything that was taken from us during this time. We will restore the good health of our residents. We'll continue to care for those who have been ill. We'll continue to also comfort those who have lost loved ones. We're going to restore also the financial stronghold here and make sure that we bring jobs and that we help those who have become unemployed, help our businesses to rebuild. And so we have a lot of work to do. But you know Prince George's County like I do, and guess what? We're going to do this work together. So hang in there, everyone. We're going to get through this together. And again, I tell you that we are working day and night to make sure that we leave no stone unturned, to make sure that we're able to recover from this. I am working for you. I am also praying for you. And so let's hang in there together. And again, thank you so much for joining. If there were questions that were not answered tonight, please don't hesitate to continue to reach out to us. You got the hotline number at 301-883-6627. Call us if you need us. We are here, and we're going to do this together. So thanks again, everyone. Be safe out there. And listen, last thing, please, this weekend, the large family gatherings are not safe right now. I know you want to do them as much as I do. But please adhere to the advice of our medical professionals and social distance. Those large gatherings are not good for us right now. We want to stop the spread of this coronavirus. And the only way that we will do it, the faster that we stay at home and we listen to the experts, the faster we can get through this. So thank you all so much. God bless all of you, and please stay well. Thank you. Good night.